Good morning, Dr. Peter Holst here, Middletown Health, Wellness, and Chiropractic, and thanks so much for checking in with our page. Thank you so much for checking out our video. So today I'd like to talk with you about something that I've undoubtedly spoken about before, and the reason I want to talk about it today is because it keeps coming up. Not a week, it seems like not a week goes by that I don't have a new patient who came in with a complaint of sciatica. They were diagnosed with it. They believe they have it. A medical doctor or another chiropractor or physical therapist was treating them for that, and not getting anywhere. Not getting the results that they were promised. Not getting the results that they want, expect, anticipate, need to carry on, because sciatica pain can be excruciating. But as it turns out, 70 to 80% of the time, those new patients do not have sciatica. So the jump to conclusion is, if you have leg pain, that's called sciatica, and it's not sciatica in many cases. So the signs of sciatica is a rope-like burning pain down the back of your thigh. Oftentimes it can go to your foot. Generally speaking, it does go past your knee. It's pain. It's a pain that is positionally related. So when you move, it's going to hurt. If you find a restful position, you could find relief. But that's what true sciatica is. And when we have you lying on your back, if we go to raise your affected leg and we can raise it past 15, 20, or 25 degrees, 45 degrees or more, that's not sciatica. Sciatica will prevent you from raising that leg much more than 10 or 15 degrees and will cause excruciating pain radiating down the back of your leg. So that's what sciatica is. That's what we look for with sciatica. Now, a couple other tests that we do to differentiate and diagnose that. But if it's a diffuse pain down your leg, in other words, it's got no real location, maybe the side of your leg, oftentimes going into the groin or something to that effect, especially if it doesn't go past the knee. If you have pain in your leg that doesn't go past the knee and it's kind of diffuse, not that rope-like burning pain, then that's not sciatica, my friends. That is typically, I would bet, I'm going to say my life, I'll bet that it would be a diagnosis of sacroiliac irritation. So the sacroiliac joints are in our lower back. They hold our pelvis together. So here's what the two sacroiliacs look like from the inside. So this is looking at from the front, and then from the back, our sacroiliac joints are hidden by the flare of the bone here. So when we have pain in the low back, left or right low back, that radiates into the leg, may hurt more when you walk, may hurt more when you sit, may hurt more when you try to get up from a seated position. That's typically sciatica pain, and it oftentimes goes out, gets tight, gets restricted from stress. So things that cause this kind of pain would be standing on one leg. If you have that tendency of standing on one leg with your hip cocked to the side, that's stressful for your sacroiliac joint. If you're sitting and you sit leaning to the side, like in the car or at home in the couch in your favorite chair, if you're leaning to one side, think about it, you're always leaning to one side, that's going to cause a stress on your sacroiliac joint. When the joints get stressed, the muscles and ligaments will hold that joint tight, restrict movement, and now you have a mechanical dysfunction. So those two joints are supposed to move like a gyroscope when we walk. If one of them's locked up, the other one has to move more than it should, creating an irritation. And sacroiliac irritation can mimic a sciatica pain, could cause pain that radiates into your leg, can cause pain that radiates into your groin. A weakness in your leg will occur. So we diagnose that by evaluating and examining the sacroiliac joint. There are many different tests that we look at for that. So if you're interested in learning if your leg pain is sciatica or not, I would encourage you to give us a call. Love the opportunity to help you. Because there's too many times patients are walking around with a wrong diagnosis, getting the wrong kind of treatment, and then, God forbid, get slated for surgery for the wrong diagnosis. So if you know anybody with that, refer them to my office. I'd love the opportunity to do an evaluation of their leg pain, their back pain. In the meantime, you have yourself an awesome Friday. Did I mention today is Friday, August 7th, 2020? I missed that, I think. In any event, you have yourself a great day, a great weekend, and we'll see you on Monday. You have a great day. Take care now. Bye.